Well, you don't. There's nothing that tells you. It's not like a mole on your skin that turns color and gets big and you're like, oh, that looks bad. I need to go see a dermatologist or something. So there's no warning sign that says, hey, I've got a brain tumor. People get headaches all the time. People get dizzy all the time. It is luckily extremely rare that the headache or the dizziness is the cause, is the effect of having a brain tumor. So you really don't know. It's just not ignoring any symptoms. The most common symptoms being stroke-like symptoms, developing weakness, some numbness or tingling, some speech problems, maybe even confusion, and maybe just temporary confusion, but not ignoring those symptoms, talking to your primary care doctor, and getting scanned if indicated. Can you feel a brain tumor? I guess I would have to get some idea of what people mean by can you feel one. Well, I feel them when I take them out, and so they can feel like anything from a rubber ball to a rock to a liquid like a yogurt. You can't, as a patient, one can't really feel it. You can feel pain from it, and some people will get sharp headaches. Generally, you would think, okay, if I have a brain tumor on the right side of my head, I'm gonna have a headache on the right side of my head, and that's just not true. While it can be true, that's not the most common circumstance. So that's really the only way you feel it. I've had some weird cases of tumors that extend from the brain into the nose, and people can feel something really weird, or they can actually, I've had one tumor where someone could hear their brain tumor. It's the only one I've ever found, so it's pretty neat. I mean, in the sense that the patient came and said, I hear clicking in my nose every time I breathe, and it was a giant tumor that went from the brain out into their nose. And so outside of those weird, gross things, no, you can't really feel it. Yes, CT and MRIs are what we primarily use. If anyone could get it, we definitely recommend an MRI. That may not be necessarily the screening scan that someone gets, i.e. if you come with a sinus headache, your doctor may not order straight off an MRI. They may order a CT, and in a lot of circumstances, that's probably adequate to rule out some condition. But really the big thing to pay attention to is if you have symptoms and they just don't go away, and your doctor can't solve that problem, and you keep having whatever it is, a headache or weakness or tingling or numbness, and a CT doesn't solve for it, well then, yeah, you may need to step it up further and obtain an MRI, because really an MRI is the gold standard. It's what we go by to diagnose a brain tumor. And keep in mind, we can do MRIs. A lot of people say, oh, I can't get MRI because I have a pacemaker, or I have a defibrillator, or I have I have metal in my shoulder. Well, a lot of those things are actually MRI compatible. And I've had a lot of patients come back and say, I can't get MRI, and after we look into it, they actually can. So it's something important to remember. Unfortunately, no. There's no blood work, there's no blood test we can get that says, oh, you have a brain tumor, whether it's benign or malignant. We really have to rely upon our scans, whether that be a CT or an MRI. That's why a lot of the research these days are geared towards obtaining blood tests and figuring out, okay, is there something that pops up in the blood before we can see it on a scan? So we can draw blood and analyze that blood and say, okay, do you have a brain tumor? Or if you knew you had a brain tumor, it was removed, is that tumor coming back, or is it growing larger? So a lot of the research these days is pretty neat, and it's geared towards that exact question. An eye doctor can sometimes detect a brain tumor indirectly. And so when you have something grow in your brain, it raises the pressure in your brain. And if you have enough pressure in your brain, even if you don't have a headache, then there are changes at the back of your eye, and they can detect that and say, hey, there's swelling in there shouldn't be swelling in your eye, and then they order a scan. So indirectly, yes. Symptoms in the brain can be anything, honestly, but the biggest things to be aware of are stroke-like symptoms. And when I say stroke-like, that's losing function, whether it's rapid, you wake up one morning and you have weakness in your arm, or whether it's slow, meaning over weeks or months you notice that you're not using your hand or your foot like you were. So weakness is a big one. Numbness and tingling, that's persistent. That could also be a sign. Headaches, and we talked about that earlier. Headaches are pretty general, but some headache that doesn't go away, or it comes and goes, but it just doesn't go away over months, yeah, that's something to be concerned about. The other symptom would be confusion. Obviously, the person, most times you don't know if you're confused, but your family and friends will say you're kind of acting funny. And so that's a difficult one because you don't really tell people that you're acting funny because you don't know you're acting funny. And so someone else has to like drag you into the doctor and say, hey, you know, you're not acting right. Maybe you need to go talk to your doctor. Symptoms vary. So when things occur very quickly, so if a tumor grows really quickly, symptoms are going to show up pretty rapidly, and because your brain can't adjust to something else foreign growing within it. But keep in mind, tumors can grow over years, decades even. And so tumors can grow to massive sizes if they grow very slowly. And so symptom onset may be decades. It could be 10, 20, even 30 years with a very slow growing tumor. So the whole range from having no symptoms to symptoms that develop in weeks or hours to something that develops over decades. It's all possible. They can. Brain symptoms, whether that be some weakness. A lot of those symptoms are driven by fatigue. And so people will notice more symptoms either early in the morning or late at night. And that's because you generally are more fatigued at those points in time. And so they can come and go based on the point of the day or how tired you might be, and it kind of seems to go away. And a lot of people will ignore those and say, oh, I'm just chalking it up to being tired, or today was a really busy day. So when people have odd smells, yes, of course, it could be something in your nose, right? It could be a sinusitis. That's going to be much more common than a brain tumor because, you know, you smell odd odors or foul odors in your nose. But it can also be indirectly related to a seizure. So if someone has a seizure, they'll have odd smells, maybe as part of the seizure complex. And the reason why someone might be having smells and seizures is because of a tumor. Luckily, that's also pretty uncommon. Brain tumors can cause headaches. They're usually generalized, meaning they're all over your head. They're usually not in a specific area. And even if the tumor's in a specific area, the headache may not be on that same side. So you could have a tumor on your left side of your head and feel headaches more on your right side. The quality of the headaches is really variable. People describe anything from pulsating to constant tension type to sharp, like an ice cream headache, so kind of like an ice pick sharp thing that makes you wince and goes away. So all those are pretty common. They can. That's a very, very common complaint, especially as we get older. The little crystals in our ear kind of destabilize, and dizziness and vertigo and those things are very, very common. Again, usually tumors are not the cause of that. Usually it's just people also describe things as, you know, I'm spinning or I have vertigo, but a lot of people actually mean I'm just lightheaded or my head feels off. And so yes, it can, but that's pretty typical to a tumor in a specific location, and those tumors are pretty rare. Yes, it can. However, again, just like the dizziness and vertigo and things, very uncommon. Yes, it can. No, brain tumors will not cause hair loss, but the treatment for brain tumors can if someone requires radiation and/or chemotherapy. Yes, indirectly it can. There are some tumors that exist that go from the neck into the head region, rarely isolated to the brain or the head, and they can cause hypertension or high blood pressure, but it's a pretty rare symptom. Yes, brain tumors can definitely cause memory loss. A lot of times people have a hard time speaking or thinking, and we say it's memory loss, but if you keep in mind, anytime you form a memory, you're really forming some type of thought that's rooted either in what you see or you formulating in some type of words, in your brain. And so if you can't speak properly, you're also not going to form memories appropriately. Yes. Brain tumors that are in the back side of the head can definitely refer their pain down to the neck. If a patient has seizures associated, yes, definitely hallucinations can occur. Independently, a rare symptom. Typically not, although there are some tumors that extend from the pituitary gland, which is at the back of the nose, and if they grow large enough, we've seen bleeding from the nose at times. Yes, absolutely. Yeah, tumors that are in the frontal lobes, meaning the part like above your eyes and your forehead region, that's your personality area. It's your thinking area. It's what makes you smart and all that good stuff, and also kind of is responsible for who you are. And so we've seen with very large tumors in that area that people become totally different individuals. There are two different ways you can think of it. One would be negative symptoms and one would be positive. Not like whether it's good or bad. What I'm saying is negative is usually when you're not interacting as much, you're apathetic. You kind of sit around, you don't interact with whomever's around you or the environment. You kind of lose interest in the things that you used to do or like. The positive symptoms are the ones where people become aggressive or impulsive or acting out, violent. Those symptoms, luckily, are very rare. Most of the time, people, if they develop a tumor, and overall to have these behavioral symptoms are not the most common thing. But if you're going to have one, it's usually on the negative side, meaning you kind of retract and you start detaching yourself from people and things. Yes, it can. Similar to, it's grouped along with that dizziness or vertigo. Tumors in that area can cause ringing in the ears. Some of that imbalance. Yes, it can. Yes, not as common. A lot of times people are placed on different medications and that causes insomnia, then we find something like that. But all of these symptoms are just not as common, but definitely within the possibility. In the sense of, we talked about metastatic disease a little while ago, cancers that grow elsewhere in the body and spread to the brain. Within the context of anyone that has cancer, yes, weight loss can occur. Weight gain is possible with certain types of tumors that occur in the pituitary gland, and it upsets your hormonal balance. It's actually called Cushing's disease, and that's actually fairly common, and people will suddenly gain a ton of weight and they don't know why. All of us experience these symptoms a few times a year, maybe every week even, depending on what kind of medical conditions we have. Luckily, and I mean, it's great that these things are so rare, because it is very rare if that patient actually gets a scan that we say, hey, that we found a brain tumor as the cause. So it is not impossible, but extremely rare. The big thing is if you're having symptoms and they continue and you've had eye twitching, it's been a few weeks, no one can come to a conclusion on why. It might be reasonable in their case to get a scan or to get a blood test. We talked about blood tests as diagnosing. Yes, we can't diagnose a blood test, but what blood tests can figure out is if your calcium's low. Maybe that's why you're twitching. Why is your calcium low? Well, it might be because of your parathyroid glands. And so that's much more common than having a brain tumor even. So really the main key as you think about these is just get it checked out. If it's something that's persistent, then ask your doctor and they'll decide, okay, this is worrisome enough or it's occurred long enough that maybe we should get a scan.